Hey, everybody here. Welcome to Hey Sawbones, my story, my passion. This week's guest, awesome guy. Was one of my college roommates, one of my best friends. I've known him for, gosh, 25 years now. His wife, Susan, their two boys, Marco and Dominic. We vacationed with them about a year and a half ago to Italy with my family. So Greg Beato. He's an amazing individual. He's a physician, internal medicine, sports medicine. He's the men's head basketball team physician at Virginia Tech, as well as women's soccer. We've been close. It's fun because anytime that we're away from each other for a while, as soon as we're back together, even during this session, we just get right back in tune with one another. So stick around, stay tuned, and remember, you want to watch Sawbones Challenge. It's going to be a little different because this is a virtual episode, but it's still fun. Have a great day. See you soon.
All nurses to the nurses station.
Lawless country people are real close family. Lately some of my kinfolk don't get around too good, you see. When that doctor asked them, son, how'd you get in this condition? They says, hey, Sawbones, I'm just carrying on an old family tradition. Wanna know, Doc, why do you think I got some pain in my joints from years of playing hard in this life that's too short? When that doctor asked me, son, how'd you get in this condition? I says, hey, Sawbones, I'm just carrying on an old family tradition. Tell me all about it, Doc.
Hey, everybody. Dr. Ryan Molly here, orthopedic surgeon, cutter of bones, businessman, entrepreneur, but most importantly, loving husband and father of three young, busy boys that are very active. But fortunately, right now, they're pretty quiet and they're staying upstairs. So this is a really cool episode. I've been looking forward to this for a while. As you can probably tell, this is going to be a little bit different in terms of the layout, the way it looks. This is our first Hey Sawbones podcast where we have a virtual guest just due to proximity and where he lives. But super close friend of mine, one of my best friends, one of my college roommates. He's an unbelievable individual, personally, professionally. Love him to death. He has a great family. Without further ado, Dr. Gregory Beato. So welcome aboard, Greg. How are you?
Yeah, great. So excited to be here with you, Ryan. I know it's been a lot of podcasts for us and for you, and just looking forward to answer some questions and get to know what's going on in your life currently.
So, Greg, as we always do at the beginning of these podcasts, I always like to kind of introduce my guests, but have you introduce kind of who you are, where you're from, so that they can get a better, maybe 30,000 foot view of kind of who you are, where you grew up, all that kind of stuff. And then we'll get into more of the details with the individual questions.
Yeah, sure. I'm originally from Rochester, New York. Went to Irondequoit High School there, and I have an older brother, older sister. I'd like to give a shout out to Mary. Mary's 50th birthday today.
Happy birthday, Mary!
That's my sister. So
Jay, can you put some confetti up in the
Feely.
air? Maybe some fireworks, things like that.
Yeah, blow it up. Yep, blow it up. She's had a tough few months, and I'm just really excited for her birthday today. My parents, Al and Carol, still live in the Rochester area, and so we're originally from Rochester. As you know, obviously, went to Hurst College in Erie, Pennsylvania, where I met my wife, Susan, at the time, Susan Ghanem, and obviously met Ryan, and we did athletic training, pre-med. I played volleyball at Hurst, so that was the really exciting time to get me to Hurst and helped me get through Erie, all of the fun and excitement at Mercyhurst, and volleyball and athletic training was really what it boiled down to. So right after Mercyhurst, I went to Philadelphia College of Osteopathic Medicine. Susan went to physical therapy school just over the bridge in New Jersey. And after PCOM, I went to internal medicine residency in Delaware, Christiana Care Health Systems, big hospital outside Philly. That was 3 years there. And then 1 year got me down to Blacksburg, Virginia, 1 year the primary care sports medicine fellowship. So that's where I am now at Virginia Tech in Blacksburg, Virginia. Been here ever since 2008, which is crazy to think about, but time flies. So I've been in Blacksburg since 2008. Do you want me to go into my practice and what I'm doing now?
I'll probably get into more of that when we go into kind of the individual business questions.
Okay.
So again, I wish you were sitting right here in this chair next to me. It's a lot more fun when we can do this in person because we can share a cocktail or a glass of wine or whatnot. But what are you drinking there? I saw you had a red Solo cup or something.
Just a way, yeah. Just I'd like to support the women's basketball team at Virginia Tech. I'm sure you were stuck to the TV watching a last-minute buzzer beater victory this afternoon for the Lady Hokies over NC State. It was the whole family was there. It was the first ever sellout for women's basketball at Castle Coliseum, Virginia Tech. So that was pretty neat. I've been with the women's basketball team for our seniors' first freshman year, and then I switched over to cover the men's 3 years ago. So Susan and I know the ladies on the team really well, and it's been amazing to see the program turn around with Coach Brooks.
Do you cover them, or do you just cover the men's?
Nope, just cover the men's. Yep. So we can just go as spectators.
That's gotta be fun, right? No responsibility.
Just really enjoy it. Yeah, I mean it was unbelievable today. I mean, literally, when I came to Virginia Tech in 2008, there might be 2,000 fans in the stadium, and there was 9,000 today.
Wow. Is that your capacity?
Just an awesome game. I mean, yeah, I think it's right around 9,000 to maybe 9,300, something like that. So it was the first ever sellout for a women's basketball game.
Do all the men's game typically sell out, or is it just dependent upon the opponent?
The big games. Yeah, the big games. I mean, the better we are, the more they're going to sell out. But our ACC games, UNC, Duke, UVA, they'll pretty much sell out, every year. I mean, if we have a great year, more of the games are going to sell out. I mean, it's just kind of nature of the beast with that. But, it was an amazing game. Not just a sellout, but, an exciting game, a game that's going to build on for the whole season.
Are they having a good year?
The women are ranked 13th in the country. NC State was ranked 3rd. Wow. They were undefeated, one of the last 3 or 4 undefeated teams, ranked high in women's basketball. So they are not undefeated any longer. So obviously we'll move up. The women's team went to the Final Four last year in Dallas, Texas. And so I think that's a very possible repeat. It's in Cleveland.
Really?
So, maybe the Molly group could come and join us for the Final Four.
I'm sure is it in April?
Early April, like April.
So similar to the men's.
So, yeah, it's the men usually play, Saturday, Monday, and I think the women play maybe Friday, Sunday, the same weekend.
But they're not at the same location, correct?
Correct, right.
Yeah, where's the Final Four
last
this year?
So this
men's,
spring, I'm not sure. The spring 2023, so this past season, there were more people at the women's Final Four than the men's Final Four, and they were both actually in Texas. The men were in Houston, I think, and the ladies were in Dallas. But I do not know where the men are this
Got
week.
it.
If the men's Virginia Tech basketball team is playing in the Final Four, I will be with the men's basketball team.
Yeah.
So that would be
well,
awesome.
Again, we would normally have our little beverage break here. I'm just drinking.
So I'm just drinking water. Just to answer
I
your
got
question.
some plain old water here
boring.
too, and celebrating the Steelers getting into the playoffs with their typical. If you win and someone else loses and this and that, and quite honestly though,
are they in?
They're in because the Jaguars lost to the Titans.
Oh wow! Okay.
And
I haven't been following anything.
They're
today.
10-7, right? Decent record, and they should have won 2 more games. They lost to the Patriots, and they lost to the Cardinals, right? So it was kind of like, but they're
Yeah.
not a good team. I mean, I'm still obviously a Steelers
Right.
fan, but I don't think they're going to do anything. And then, did you see T.J. Watt got injured?
I read the bottom line. He's out for a couple weeks, I guess MCL or
Yeah,
something.
I mean, you never know exactly the extent medically, but they were saying a grade 3 MCL, which to me is like it's a complete rupture. So I don't know how you're coming back in a couple
Yeah.
weeks.
Yeah.
So
Wait, you mean the reported injury news is not 100% factual all the time?
I guess that's the presumption I'm making right now.
It's not at Virginia Tech, I can tell you that much. But we won't talk about that.
So Greg, the format, I know we kind of talked about it a little bit through text message, but you'll ask me 3 business questions, then 3 personal, and then we'll turn the tables. And that's the more fun part because, again, I think my guests are probably bored because a lot of the questions may get repeated, but, I'll try to jazz it up a little bit, and then we'll get to learn more about Greg Beato. You ready?
That's what America
Right
wants.
there. So fire away.
Well, I thought the as a selfish reason, I text you every so often asking some orthopedic questions and some joint replacement questions because I do a lot of non-surgical orthopedics in my office. I do injections, hyaluronic acid, those kinds of things, and I thought that it would be good for patients as well, but also for me. What do you expect from primary care doctors on referring? When to refer, what should be done ahead of time for a patient that we think needs a knee, needs a knee replacement, needs a hip replacement. What would you like to see your primary care, colleagues do ahead of time, or would you like them to not do anything?
Yeah, I mean, quite honestly, I would say maybe what not to do is an easier way to
Yeah.
answer that question. I don't need an MRI. There are very, very, very few instances that I ever order MRIs. I would say of all the joint replacements that I do every year, maybe 5 out of 8 to 900. And if I do need that, I would say let's save the healthcare system and let me order it. Because it's not going to change anything. Plain X-rays, and then the same thing too is you can get X-rays obviously in your office and this and that, but I would maybe just tell your patients that when you go, specifically our practice, we are always going to repeat X-rays because we have a very specific series of X-rays that we're getting because different patterns of arthritis show themselves on different views. Like for instance, if you had isolated lateral compartment arthritis, a Rosenberg view or a PA flexed, where you're shooting the X-ray from behind with the knees flexed about 45 degrees or 30 degrees, is going to show that disease pattern better. Whereas if you just have a standing X-ray, they may look like they have normal X-rays. Injections, I mean, I get it. Certain primary carers are very comfortable doing joint injections, particularly the knee. I think it's a pretty easy joint to inject. Hips, I would probably leave that. I think you would be very good at that, especially. Do you use ultrasound, Greg?
No, I wish I got into that training, but that started kind of standard several years after my primary care. So I'm picking up a little bit, but no, I don't think I would not do an intra-articular hip. Personally, I don't think many primary care sports docs would unless they're doing ultrasound guided.
Yeah.
And that's probably makes sense. I leave it to the orthos.
We don't even do it under ultrasound. We do it under fluoro or X. I guess not fluoro, but X-ray. So we know exactly the fact that it's actually going in the joint. But other than that, I would just my message, especially where we're practicing, we have such a large catchment area. I mean, it's 3 hours every direction. So most of our referrals aren't necessarily from primary care doctors. Occasionally we'll get them, but they're more just kind of word of mouth. We do
Self-referred.
Self-referred, yeah, or
okay.
You did my neighbor's hip or knee or this or that. Obviously, we greatly appreciate.
Yep.
There's a couple heavy hitter referring docs in the area. There's a couple up in Erie that send stuff our way, and I quite honestly, they just kind of send it to us and they let us do it the way that we typically do it, and order the tests that we think are necessary, which are usually pretty rare. We have X-ray in our office.
Yeah. Well, my take home from that's helpful for me. I mean, I think it's good for me to not warn, but preface that yes, we've done X-rays. Like I will have absolutely already done X-rays. I kind of have a sort of unwritten rule that I'm probably not going to inject a joint if I haven't done an X-ray ahead of time. I think that's just the safest way to go. I mean, not 100%, but so I've probably done X-rays, and I think it's good for me to probably change my just hey, ortho's probably going to because they do. I mean, they're 100% going to repeat
Yeah.
X-rays. Why not just tell them that ahead of time, so the patient's not questioning you all and slowing things down in your office. What do you think? So, how about steroid shots
Yeah, I'm glad you went there.
ahead of knee, hip, especially knee? Are you going to wait 3 months? Are you going to wait 6 months? Do you have a preference on that, and is that a standard thing that all orthos
I
follow,
would
or is
say
there a little
all
bit of wiggle room?
orthos typically follow in bare minimum 3 months. So 90 days from last intra-articular injection into the affected joint. So if you had one into your right knee, but we're doing your left knee, you can do the left knee replacement anytime. But
Yeah,
recently, within the past 6 months, the American Academy of Orthopedic Surgeons and several other papers have shown that the risk is still elevated even up to 6 months. So we as a practice have decided that we are no joint replacements within 6 months of a steroid injection directly into the affected joint that we're operating on.
yeah,
And I mean, because quite honestly, I tell my patients, short of dying after a hip or knee replacement, the absolute worst complication, in my opinion, is an infection. They're disastrous. They're
yeah.
for the patients, for the surgeons, for everybody involved, for the healthcare system. It's a huge drain on the system financially, and the patients. It's a good year of your life that has just been chewed up.
Yep.
And I tell patients,
Good.
like,
And
once
then
you're kind of like at that point where you want to have a joint replacement, don't do any more steroid injections. Like, just stop.
yeah, just do the joint. Yeah, just go do it.
Now there is that period, right? So if they had a joint injection, say in December, and they can't get their joint replacement for 6 months, say June, we do have some cool alternatives that we can start using. Have you heard of Iovera or cryoneurolysis at all?
No, not specifically. My next question was going to be about alternative injections, regenerative medicine. There's some data on PRP. I know you're seeing severe end-stage disease in
Yeah.
general, but no. What's
Iovera
cryo neuro?
is a procedure where we actually started doing this about 7 months ago, and we do it for all of our knee replacement patients, 2 weeks and a couple days before their upcoming joint replacement surgery. What it does is it goes in and around the knee, and it literally temporarily kills the nerve by freezing it. There's a handheld device that has very short needles that go in. We know kind of the superficial anatomy through mapping of the nerves and where they're located based upon landmarks and measurements off of the patella and the joint line. But my PA, Jake, who does all of our Iovera treatments, he's actually become very, very proficient with ultrasound use. So he can see those nerves and he can know that he's directly hitting those nerves. So we do that before surgery. And the literature, this is not new. This has been out since, I believe, 2013. It was originally put out there in the plastic surgery world kind of as an alternative to Botox. Because, as Botox, it kind of like causes those impulses from that nerve to relax, so the tissue relaxes. Well, this is it's not a chemical reaction because it's no medication that's getting injected. It's literally an ice ball that freezes once the needle is right next to that nerve, and then you'll get Wallerian degeneration. For the lay people out there, that's just the nerve will, from the point of freezing to the point of where it innervates the tissue, it will actually degenerate and essentially die temporarily. It's still intact. So over the next 90 days, it takes about 3 months, those nerves will regenerate along the tract because the tract is still there. The nerve's still there. It doesn't like disappear. But it's been shown to reduce the amount of pain after a knee replacement by up to 50%. And it's been shown to have reduce the amount of opioids necessary after a knee replacement by up to 50% as well. So it's a pretty big deal. With regards to the other stuff, quite honestly, I leave that more to the great Coppolas, more to yourself. I know my lane, and I've never gotten into the biological stuff. I think there's definitely a role for it. I don't think there's really a role for it in end-stage osteoarthritis, but there's a lot of
Yeah.
pain generators when we're dealing with joints, right? It's not necessarily always the bone touching the bone. It could be the surrounding soft tissues. And I think that's really where the biologics have a role. But
Hmm.
when people are saying, hey, we're going to inject this, whatever it may be, and it's going to regrow cartilage, I've never found a chemical on planet Earth that's been able to do that.
Yeah. I mean, have you seen knees? Well, I'm sure you have seen knees that have had PRP, stem cell, and those therapies that maybe worked for a while, maybe didn't work at all. Like when you're in there, do you ever say, "Oh, look, this knee it looks different," or it just kind of all looks like bone on bone severe?
I've only probably
You
had a
know?
handful of those. Surprisingly, I think I would have thought I would
Okay.
have seen more. Now, I do think it's maybe not fair because the people that end up coming to me, it obviously didn't work, right? Or maybe it worked for a period of time and
Right.
then it stopped
Right.
working. But
Right.
the
Right.
people that it does work for, I think my personal belief is that it's not because it's regrowing cartilage, because I just don't think that happens with that. Like, how's it going to just adhere down and start to regrow right there? To me, that just doesn't make a lot of
Yeah, it's
sense.
not doing that. Yeah.
But I think there's other biochemical processes that may go on that may make it feel better.
Right.
But I've not noticed anything in the handful of cases that I've seen where it's like it looks
Yeah.
different.
Yeah. I was curious about that because I think I don't know what the climate is in Erie and Meadville and that area of regenerative medicine. I mean, obviously Dr. Kobla is doing a lot, and I'm sure there's a handful of other people doing it. But in theory, and if the literature is correct, which it may or may not be, I mean, you can stave off seeing Dr. Molly 4, 5, 6 years. Well, we haven't probably been doing stem cell and those intra-articular things for that long, so you wouldn't have seen the lifespan of those stem cell injections yet. So you might see them, 3, 4, 5 years down the road.
Yeah, I have seen a couple things on
Depending
like
on
LinkedIn with like the disastrous complications, mainly in the hip, a couple cases in the knee where it actually induced like osteonecrosis. And like this patient had this $10,000 cash pay procedure to help their hip that was bone on bone arthritis.
what did they do? You know what
Gosh, I wish I knew off the top of my head what the
That's all
what
right.
the injection was, if it was bone marrow aspirate, stem cells, or some other type of, but it was a
Yeah, some
biological.
sort of
Yeah.
regenerative.
And the couple cases that I'd seen, obviously you're seeing the bad cases, right? But it induced like
Right.
rapid onset osteonecrosis, which is just where the bone dies and collapses. And it was like, well, we probably should have just
Not
done
good.
the hip replacement before. I mean, it's like Monday morning quarterback stuff, but
Yeah.
yeah. So what else?
Yeah. I mean, those were my three that I wrote down that I wanted to address. You want to
Do some
go
personal? Yeah,
personal
we
now?
can do
Or?
personals, then we'll
Yeah.
turn that table.
I wrote down a few that are probably not PG
Connie
related
Molly's
personal,
watching,
so we're gonna
and Carrie
we're
Conham's
gonna
watching.
wait. Yeah. I figured that Carrie. Oh, does he watch these? He watches them pretty much. Okay.
I think every week I get an
The
email
reason
from
I
him.
agreed to come.
Hi, Carrie.
Yeah, I mean, quite honestly, the only reason I agreed to do this was to earn some extra points with my father-in-law.
Yeah, well, you obviously
That
haven't.
was it. Now,
You obviously
now,
aren't doing it to earn points with me because you haven't watched any of them yet. So
well, right, and I don't have. I mean, I don't have to do that, but he is a relative, so now he thinks I'm credible.
Jared's not a relative
I
either,
got
but
on
I'll tell
here.
you one thing. He texts me every episode. He's like, "Oh, that was a great episode. I didn't want to leave the car." There was one particularly with the head men's basketball coach at Gannon now, who's killing it. I mean, they are unbelievable, and the style of play. We can get into that later because I think that you'll.
I mean, Susan said something about you having a Gannon coach on, and that just
Maybe that's why you
had
haven't watched anything.
little regurgitation, little agita, and
I actually was wearing Gannon gear too, Greg. It was bad. Yeah.
Oh man, you're a sellout. Wow. Okay. I want your fans don't know how psychotic a golfer I am, and just how much I've enjoyed watching you get into golf a little more. So I wanted to ask you what your golfing goals were or are for 2024. Do you have any golfing goals for
It's probably the
2024?
same goal that I set every year that never happens, but maybe this is year to actually start doing it, which was to take my first lesson. I've never ever taken a lesson,
Oh, okay.
and I say it every year. That's one of them. The other is to play more consistently. Like my buddy Travis, who you met, every year, spring comes up. We're like, all right, this is the year, right? We're going to set out, and we set out, and for the first month and a half, June, half of July, we do well where we play 1 day a week. It's usually a Thursday night after clinic. We're the last guys on the course and we're the last guys off. All right. So we're getting out there maybe 5 o'clock, and it's nice in the summer because you can play late. We usually finish 8:30,
Yep.
and it's awesome. I mean, you've played at Kakwa, so but yeah, I want to
Yeah.
do that more frequently, and actually stick to it because I'm so busy with other stuff with the boys, right? They all play travel baseball, so summers are crazy. We
Yep.
want to get to the swimming pool at the club, and we want to do this, we want to do that. But like to do something
Yep.
that's like for myself, I really want to do that more consistently this year.
Yeah, and I think that golf, golf is more than just an activity in my mind. I mean, I know it sounds a little melodramatic at times, but it is a great place to hang out, meet people, get to know people better. I mean, taking some time for yourself is super important. I mean, you've played more and more the last, I don't know, 3, 4, 5 years. So you've done. I mean, you followed some of your goal. It's just a matter of sticking with it when life
Yeah,
gets
it's the lesson thing,
super
honestly,
crazy.
because I get frustrated every year where
Yeah,
I start out good because I haven't had the winter to have bad habits, and then I go down, and then I get better throughout the year, and then I stop
yep,
playing. And I
yep,
mean, last year was kind of our highlight because I think I shared with you, Pete and I won the member guest, which was
yep.
huge accomplishment, and it was just one of those
Hmm.
perfect storms where everything aligned for about
Yep.
4 to 5 hours, and that's all it takes.
I mean, that's a long time to have the blood alcohol level just perfect.
I think that was the key is we were just like bare
Yeah.
minimum, right? Like have a drink, but not
Yep.
too much. And you know what it was? I started playing Pink Floyd too on that last day. I was like, Pete, I know this isn't
All
something
right.
that we've
Just
ever
chill
played
you out
to,
a little
but
bit.
this is like my focus music in the OR, and we had a chance. So that was probably I was like, let's just try this, and we did it, and it worked.
Yeah. So I would definitely encourage you to take a couple lessons. I had maybe 45 minutes with our head pro, Brad, and he changed like 2, 3 subtle things this past spring and made a huge difference. I mean, you don't need to overhaul your whole swing. I don't think that's the way to go
Yeah, I'm
about it.
not I'm
But
not
I
joining
think
the
you're
tour
right. I mean,
here or anything.
no, but there's some subtle changes and things that can make it really good. So
Yeah.
nice.
What else?
You want me to keep
Yeah, we
firing
got
more?
I think two more personal, and then I'll ask you some questions.
Yep. So I was going to try to catch up on a little bit of vacation. I'm sure most of your listeners know about the Italy trip,
Yeah.
and they're maybe tired of hearing about it.
No, I think this will be kind of cool
Um,
because you're the first guest that was there with me to experience it firsthand.
yep. So, we went to Italy a little over a year ago, both the Beato and Molly families, and 6 kids, 6 boys, or 5 boys. Um, I will tell you that I felt like it was a amazing success. Yeah, were there bickering and fighting, whatever, but it was a trial run for such a big trip for my kids. They were 8 and 10 at the time, 9 and 11 now. Do the Molly? Where are you at with the next trip? I've been told don't end your first big trip without planning the next trip, and I'm sure you have some trips in between. But do you have any big Molly family trips coming up?
Yeah, so since COVID kind of robbed all of us of our lives for a couple of years here, especially with traveling and trips and vacations, that year when we went to Italy, which was 2022, because we were in October, the
Hmm.
last 2 weeks of October of 2022.
Yep.
we kind of committed because that trip was actually supposed to happen the year before, and then it got delayed. And so, it's been like I would agree with you, Greg. I think the trip was an overwhelming success, with blending two families together that the boys had met before, but not spent any significant amount of time together. And honestly, some of the best memories that I will cherish for the rest of my life, right? Like the sights that we saw, the ground that we walked, the meals that we ate, the wine that we shared, the views that we saw. I mean, my favorite. I'll answer your question, but I just want to like hit on a little bit of this. Is that view from
No,
our
yeah, talk
house
about
in
it.
Amalfi every morning going out there? I just
Yeah.
wish we would have spent more time there. In hindsight, that's like my only regret. Maybe that's round two. But
Yeah. Just a week there, 2 weeks.
yeah, but I mean, in Amalfi, we were only there 3 nights.
Yeah.
Yeah.
In Amalfi. Yeah.
Yep.
You're right.
But so we've got some trips. I've got some little trips with the boys. So I made a tradition last year that I do like a little getaway with each of the boys individually as kind of like a Christmas / birthday / just father-son time. And it's just one of them. So Santino and I are going in 2 weeks to San Francisco for 2 nights. We're going to see the Warriors play the Mavericks. Last year we went to Charlotte. We saw the
Nice.
Hornets play the Celtics. But yeah, and we're going to go to Alcatraz one day. So we've been watching movies about Alcatraz. Santino's been reading books about Alcatraz. Anthony and I are going to Boston. We're going to catch a Celtics and a Mavericks game. So I have 2 Mavericks games. And then Luca, we're still trying to figure it out.
And that's just random, right? You don't care about the Mavericks.
No, it was more like, where would you really
was
want to
just-
go? And Tino really has been years
Yeah.
wanted to see Steph Curry play, as have I. So this is our first chance.
Yep.
And
Yep.
we couldn't do the Cleveland one this year because Karen and I were on a trip with Stacy and Pete. So, but we're going out there. And I just think it'll be a cool city because that's part of it too, is like the travel. And we've got some great restaurants lined up. So I like to look forward to
Yeah,
stuff.
so much to do.
Anthony and I will be
Yep.
Boston because he likes the Celtics, and then Luca, he's more of a baseball guy, but we're either between Cincinnati Reds going there, and then he just a couple like the Christmas New Year's week. He said, "What about New York? I'd really like to see the Yankees." I'm like, "Ooh, that could be a little intimidating going to New York just with you and I." But either that or maybe the Knicks. So I just have to look at the schedule to see. But we have our annual. We started going to Sedona 3 years ago for Easter
Oh, right.
every year for a week. So we're going to be in Scottsdale for I think 3 or 4 nights, and then Sedona for 4 nights. Again, we know that area well now, so we have like our favorite restaurants that we go to, and we do hiking during the day. And then our big trip is kind of like the Italy trip, but the Greece. So
Yeah. That's what I want to hear
so
about.
we literally just last Sunday, New Year's Eve, Stacy and Pete were out here for the weekend, and we must have spent 8 hours doing what I think it was more Susan and I, like sitting down and figuring out like where we wanted to go. We didn't do like our excursions yet, but like the VRBO piece of it, like where we're going to stay, which was harder than the Italy one just because we don't have as much time. Like I booked those houses well over a year in advance versus 6 months in advance. But so we were like, do we go to this island? Do we go here? Do we go here? But we wanted to get to the mainland where Karen's family, Stacy's family, and Pete's family are from. And fortunately, they're all from the same kind of area on the Peloponnesian Peninsula. But we're flying into Athens on a Saturday. I think it's the 22nd of June. And then we are going to fly or actually drive over to that area on the Peloponnesian Peninsula where their families are from. And we have a VRBO that's literally right on the Mediterranean Sea there. We have a private beach, we have a pool, and we'll be there for 4 nights. So we'll be able to do day trips, kind of like we did when we were up in Tuscany, to see Pete's family, where they came from. And Karen and Stacy's family, they have their uncle has a place literally 30 minutes from there. So, and then Olympia is north of there by about an hour, maybe an hour and a half. So we're going to go there, and it'll be cool because the Olympics will be actually going on while we're there. So the torch will be lit in Olympia.
Oh
which
my.
obviously only
Will you be able to so we're talking the Paris
the
Olympics.
Paris Olympics. Yeah. So when they do it, I didn't realize all
Got
this.
you.
They start
Yeah.
the torch there in Olympia, and then they transport it to wherever it's going. But they
Okay.
leave the torch lit in Olympia until the Olympics
Okay.
conclude. So we'll actually get to see the torch lit in Olympia, which would
Cool.
be kind of cool.
Yeah.
And then we're going to fly
Yeah.
to Crete, which is a very large island south of Greece proper. And we'll be there for, I think,
Mm-hmm.
6 nights. We're doing 2 weeks, just like we did in Italy.
Yeah.
And there's
Nice.
just a lot to do there. I mean, if there's so many islands, if we want to do like a day here, a day there, we could do that. But there's lots of hiking trails in
Yep.
Crete. And then obviously great restaurants with Greek food and beaches. That pool or that house actually has a pool, and it reminds me of our first house in Italy because it has a basketball court too. So Stacy and Pete have two
Yep.
boys,
Nice.
Georgie and Nicholas, who are a little bit
I was just gonna ask
yeah.
that.
So it's
Yeah.
it's the same. It's just their boys are Nicholas is I think 9 months older than Anthony, and Georgie's probably 2.5 to 3 years older than Anthony. So, but they all get along.
Nice.
And then we
Yeah.
fly back to Athens and conclude our trip there. I think we're going to do 3 nights in Athens, and then we'll do like the Athens type stuff, right? Like the Parthenon and
Yeah.
all that.
Yep. Yeah.
So
Awesome.
yeah, looking forward to it.
Yeah, I've heard amazing things. Greece has been like a hotbed of people traveling to in this area for some reason. I think that Susan's sister Robin went on their honeymoon to Crete.
Oh, okay.
So I don't know if they're history people. So you might want to hook you guys up just for some information.
Yeah, why don't you
about
confirm
things
where
to
they
do. You're
went?
gonna be there six.
The good news is again,
I'm pretty sure it was
yeah,
Crete.
being kind of married into a Greek family, they've all been to Greece multiple times.
Right.
And then Karen
Yeah.
and we went to Santorini 5 years ago for our 10-year wedding anniversary, and that's a beautiful
Nice.
island too. It's very commercialized now, so we decided to try a different island, and I don't think anybody's ever been to Crete, quite honestly, from our travel group. So it'll be nice. And then Stacy's mother, Connie, is coming, and that is Karen's mom's sister, Mary's sister.
Okay. Another Connie.
And then
Great.
Pete's mom, Georgia, is going to be joining us as well. And then we invited Karen's parents, but I just don't think that Jim, with his health issues, is comfortable traveling that far for that long. And I totally get it.
Mm-hmm.
But we're going to bring Andrea as well, and
Yeah.
she was obviously with us on the Italy trip.
Yep. Yeah, nice.
So is that 3, or you got
Awesome.
one more, or what is that?
I mean, I got one more if you want it.
Fire away.
I wanted to hear about Erie a little bit. I've been to Erie a couple times, and it's changed a bunch since a long time ago. I'm not going to say that 25. We started college about 25,
Yeah, that's crazy.
26 years ago. But so I've been to Erie a couple times with Susan's family and stuff. So do you have favorite things in Erie to do? Kind of the you don't have to name all of them, but like down the lakes. I don't know what do you call the lake
The
down by the
peninsula?
lake, not Presque Isle, but like
So
in the town, in the city. Like that whole thing is new and it's actually really awesome. I mean, when we've gone to it, we've really enjoyed it.
to Presque Isle, you're saying?
Restaurants and just Presque Isle we know.
Yeah.
I mean, I haven't been to Presque Isle.
What did you say
in a
about the
while,
city? I
but
didn't hear your question about the city.
like the Hammett, like where Park Place
Oh,
used
yeah,
to
yeah,
be.
yeah. Like
that
the new
whole area.
downtown. Well, I can say this. You've
Yeah.
seen more of it than I have, and I'm embarrassed to say that. They have a food court down there. I think they
Okay.
have rock climbing down
Yep,
there.
yep.
I think they've done
Yep.
an amazing job of like the downtown revival. It's just, and I guess I'm making excuses, but like we don't really. It almost feels like it's a journey to go downtown, and it's like, oh my
Yeah,
gosh.
I get it.
And we typically stay on the west side, or we're doing something with our boys. Now, I have taken our boys to 2 Gannon games. Sorry, I said that G word again. This year, and so we are downtown. But I think we just need to do it. We need to get downtown to see that. And but I've heard nothing but really, really good things about that.
Well, so what? So where are your favorite hangouts then in terms of family stuff? Where you do
Yeah,
go?
I mean, we'll go to Cockwell, we'll go to the club, but then there's just some great restaurants that we typically are just comfortable at. Like, there's not a lot in Erie to me because I like food. Karen and I consider ourselves foodies. That's one thing that we really really enjoy doing together is finding good places that have really good food. But there's a couple. There's some Italian restaurants. Peppino's is probably, in my opinion, one of the best restaurants in Erie, Pennsylvania. The Cork is really, really good, and I've never had a bad meal there. Bar Ronin is probably one of our favorites. It's this Asian fusion type place that almost transports you outside of Erie while you're there. There's Japanese kind of like hieroglyphs or graffiti on the walls, if you will. Makes you feel like you're not in Erie, and the food is phenomenal. They have the best burger I've
Yeah.
ever had in my life. It's called the Lucy Burger. That's there. When I bring guests there, they're like, "Oh, I want to try this," and they're trying all these Asian things. I'm like, "Try the burger." And they're like, "Seriously? I didn't come here for the burger." I'm like, "Try it."
Yeah.
They'll do it, and they'll
Yeah.
be like,
That's
"Oh my god!"
interesting.
And then just the
Yep.
staples. Like I was at the Peninsula this morning. I like to go down there and go for long walks, and I do think that there's a lot to do in the town. Erie gets a pretty bad rap being kind of the mistake on the lake and cold and dreary. But the summers in
It's
Erie,
just the weather.
but the
Oh,
summers you can't
yeah.
beat.
The
You
summers are
cannot beat
great.
the summers, and even the fall in
Yep.
Erie.
Yep.
But yeah, this is a
Yep.
long haul. We've had a pretty mild winter so far. I just feel like it's going to go long because we haven't had a ton of snow.
Yeah, I was in Rochester for 4 nights visiting family after Christmas, and we didn't see the sun once. It was gray, cloudy, little rain, flurry the Saturday that we left, but we were probably eating, talking to my dad on I think a Friday. It might have been when we were driving to the airport, and he looked at me and he said, "Boy, you guys really got lucky with the weather." And I'm thinking, "Oh my gosh!" And he's right because you could have had a 2 feet
Yeah,
of snow, but I'm thinking, "Oh my gosh, this is dreadful and
you grew up
depressing."
there.
And I know, and I'm like, man, and he was thinking, well, this is pretty good. So I guess
It's
that
all
goes to
relative, right?
show you that yeah, it's all relative, and we get pretty cold in Blacksburg, but we see the sun a lot. We don't get much snow. I mean, we get the 4 seasons, but it's definitely a lot more mild in the winter times, and the summers are great. So you wouldn't know, though. I mean, you don't. Maybe if you ever get down to Blacksburg,
I was talking with Susan.
maybe we'll show you.
Yeah, I was talking with Susan, and I think we picked a date, and then I realized it may be the same weekend that Anthony and I are supposed to be going to Boston. So, but we will make it.
I mean, your listeners can understand after hearing all the trips, and that's not even any professional trips or any
Yeah.
conferences. So it's hard. I give you a hard time, but it is a challenge trying to get. We were doing similar things with the boys. We have Marco Day and we have Dominic Day, and so basically we let them sort of choose within reasoning a trip of some sort. Maybe it's a game, maybe it's amusement park, those
But
kinds
you
of
only bring
things.
one
And
of them.
sitting at the calendar, right? So no, we bring them
Okay.
both. We do bring them both. We haven't, and it's not their birthday. It's just a special, day or kind of turns into weekends sometimes. But yeah, we bring them both. I like that idea though. That might be something to consider doing, just kind of a day trip with just one of them. But anyway, so it seems that the calendar can fill up quite quickly.
Yeah,
Quite quickly.
I will. That's my,
But that's good. It's not a
yeah.
bad thing.
No, I mean, but it's balance, right? So, I do promise that we are going to make it down there. I just can't promise when.
Oh, there was I mean, it's being recorded, but so way to leave it open ended.
Yeah.
So that's all right.
Let's
I get
spin
it.
those tables so I can ask you some questions. Okay. So
Let's do it.
again, I know you. I think it's always fun for me because I get to learn about my guests during. It's one of my favorite things about this, and even the people that I think I know really, really well, I always learn stuff about. Jared, grew up with him and learned some cool stuff during our podcast. But who was that person for you, Greg? That was like, your mentor that kind of like, this is what I want to do. I want to be a physician. I want to be a primary care internal medicine physician that also kind of specializes in sports medicine or non-operative orthopedics. Who was that, and when in your life did that happen?
Yeah, it's a good question. I mean, I think that clearly when I had decided to go to medical school, after that decision, have you had Dr. Coppola on the show?
Greg, I've invited him about a dozen times, and yeah, I'm starting to think maybe
Yeah,
it's not going to happen. But
it's not
yeah,
you. It's not you. But I mean, he was my mentor. I mean, I think he went to PCOM.
but you knew beforehand you wanted to
Obviously,
go to, like when you came to Mercyhurst, I feel like
medical
you
school.
were pre med. I was pre med, but not because I was going to medical school. I was going to chiropractic school.
Yeah. I mean, when I went to Mercyhurst, I did not know what I wanted to
Okay.
major in. I went there because I got recruited to play volleyball, and it was a good distance away. They had several majors I was interested in. I mean, I was interested in engineering, architecture, journalism. I mean, there was a bunch of just and Mercier's had pretty much all of them. And so I'll never forget. I mean, I remember going to the athletic training sports medicine intro meeting, for interested freshmen. And I was like, oh man, that sounds good. Sports and medicine. I mean, that sounds neat. But so I didn't know I wanted to
I
go to
thought you
medical
did.
school. I probably didn't really know. No, so you
Yeah.
learned something.
First question.
I my I hadn't. I don't fully know why I carried on the pre-med. I guess it's pre-med concentration. Someone early on, it might have been Sue, suggested to just do that. It was just a couple of changes in a couple, instead of one chemistry, you take general chemistry, a couple of physics kind
Yeah.
of things. And I don't fully remember thinking a lot about that. Like, oh, I'll just do that. I don't know. I didn't make as educated a decision about that. Probably, I thought, oh, okay, I'll do that. And then, I didn't really fully hear about osteopathic medicine until I think my sophomore year. It was not talked about at all at Mercyhurst, which is, I hope they are doing a better job about talking about osteopathic medicine, considering LECOM, being there for so long now. But
I believe they are.
whole
One of their
story,
new
not
team
to bore
physicians
your audience.
is a DO there. So I bet you he's.
Good. Well, and obviously Greg was
Yeah.
there. So I learned about osteopathic medicine from my brother's good friend, Amy.
I remember.
So Amy is an OBGYN, PCOM grad, and she connected me with Greg Coppola because they were childhood friends in the Pittsburgh area. And so Amy taught me, brought up osteopathic medicine. I thought like it fit perfectly with sports medicine, orthopedics, primary care, everything I was interested in. Then I met Greg through Amy, connected with him several times on the phone. Obviously, we made the trip junior year to Michigan State and Chicago, and met Greg, and
You guys both had to change my
I
life
think
plans.
Greg,
Unfortunately, I mean, fortunately.
Yep, we changed Ryan's life, and then made a great connection. I think Greg, Greg is just that kind of person that has never met a stranger. Instantly you can connect with Greg very, very deeply, and so it's an easy mentor. I was very focused on PCOM. That's where he went. That's where I wanted to go, and was fortunate enough to get in there. And but that whole track of primary care versus surgery, and then sports medicine, was really about what Greg taught, and and then having the year, Greg being actually the team physician at
Yeah, that was a pretty
Mercyhurst
cool
our
year.
senior year, just a wacky, just an odd
Coincidence.
and it things happen for a reason. So we both spent more time with Greg and shadowed, and then the rotation year or month was that probably third
Yeah, I
year
think so.
in
You
medical
came
school.
out
So
and-
I
we rotated with
made
Greg at the
that
same time.
jaunt over to Erie from Philadelphia,
Yeah.
and So I think Greg definitely molded that from an early standpoint.
Yeah. So you brought up osteopathic medicine, right? So, I mean, we both went to osteopathic medical school, but you got to remember, not everybody that's listening to this knows what that is, right? They think physician and everybody goes to medical school, but can you just kind of like spend? I'm not even going to count this as one of my official questions, but just educate our guests on allopathic versus osteopathic.
Yeah, absolutely. I love this question. I remember early on thinking, "Oh my God, I don't want to have to explain this every time." Now I love it. Like I'm very happy to talk about it. I mean, you have your MD, medical doctor. That's an allopathic physician, and then you have your DO, doctor of osteopathic medicine or osteopathy. So they're both 4-year, fully accredited medical schools. There are so many more osteopathic schools now than there were when we were applying. I think there was like around 20 when we
I
were
think LECOM
applying,
has
and
about
there's
15 of
over
their own.
40. Yeah, and they all have multiple branches, and I mean, there's probably 40 to 50 osteopathic
Oh, wow.
schools now, and which is great, really. I think that's the osteopathic philosophy is slightly different than the allopathic philosophy. Osteopathic medicine was really hunkered down in primary care. The founder of osteopathic medicine is A.T. Still. It was founded in the late 1800s. And his concept was bringing primary care providers to more patients. So there's a lot of underserved areas. Even still are a ton. Probably more, potentially more patients underserved than even in the 1800s because the population is so much bigger. So one of the concepts of osteopathic medicine is very much holistic, mind, body, spirit connection. Every the structure and function, and it fits really well, in my opinion, to primary care. So that's primary care is thought to be, internal medicine, family medicine, OBGYN, peds, ER, like the kind of core medicine specialties. That was really the foundation of osteopathic medicine. But in the last probably 50 years, osteopathic physicians can go do any residencies. There's neurosurgeons, there's obviously orthopedics, cardiology, any specialty, any residency and specialty can be done after graduating from osteopathic medical school. So still 4 years, just like MD school. We take the same classes, take mainly most of the same tests. Osteopathic, the one big difference is we use our hands a little bit more. So we're a little more into manual medicine. So osteopathic physicians all go through a 2-year curriculum in medical school called osteopathic manual therapy or osteopathic manual medicine. There's a bunch of sort of different acronyms that mean the same thing, where we actually touch our patients. We try to develop our palpation, our skills, our structure, landmarks, and then, certainly, I don't know, maybe 5 or 10% of DOs, maybe less, will actually continue to do manual medicine techniques. I always say it's sort of similar to a chiropractor, but a little bit more well-rounded. It's just not about cracking necks and backs. And I do OMM every clinic at Virginia Tech. Our student athletes just love manual medicine, whether it's treatment of an injury or if it's just a maintenance, just feels good, helps to loosen things up. We have student athletes that come in all the time. It's for OMM or OMT. That's probably in the big picture. That's the biggest difference between allopathic medicine and osteopathic medicine is we learn osteopathic.
Yeah, and I think hand in hand with that, and this really, I think, gave me a leg up, was the focus just on the musculoskeletal system as opposed to some of the other sciences that we learned. And correct me if I'm wrong, Greg, but I do remember hearing a statistic. It was somewhere around like 5% of the curriculum in allopathic school focuses on the musculoskeletal system versus osteopathic. It's like 25 or 30%. I could be wrong with that, but
I don't know that data. I mean, it seems right. That would be
it's huge
in the ballpark.
and I think a lot of that is the OMT and the or OMM, whatever you call it. But we're spending a ton of time in the cadaver labs and learning the anatomy, the physiology, the functions. And it was nice coming from our background at Mercyhurst in sports medicine because it was a very natural transition, I think, into osteopathic medicine. And we had already learned, pretty much all, if not
Yep.
more, of the special tests. And we're already doing it. And we're very proficient at touching our patients. Right at that time, we're our athletes, right? And increasing our palpatory skills and our proprioceptive feedback as to being able to stress ligaments and determine if they're intact or partially torn or fully torn. And, so to me, I felt like I was very lucky. Maybe just fate had it that way that I was going to Mercyhurst. I was doing the athletic training, sports medicine background along with the pre-med courses. And then when I decided on residency or medical school, the osteopathic route from you and Greg. And by the way, I would say 80%. You need to start watching some of these because 80% of the podcasts that I've done have probably your name has been mentioned or Greg's has been mentioned or both. Because I give you guys a lot of credit for me being where I am right now and wouldn't be here without either of you. And then my transition from osteopathic into orthopedic surgery was it just all seemed very natural.
Yeah, it was
Yeah.
natural. Yeah. Yeah, I mean, I talk about with my medical students. So I usually have a medical student rotate with me, and we try to talk about orthopedics and sports medicine and primary care. Obviously, is a big part of what I do. But the training at Mercyhurst was unbelievable in terms of orthopedics. Structure, function, anatomy, innervation. I mean, all of those things were so helpful, but I certainly needed, and I'm sure you were the same way, the micro, the biochemistry, all of those sciences. I had to spend extra time to survive and get
Those
through
are
those,
brutal.
but it was nice to not have to.
That's not how my brain works.
I start shaking. I start shaking a little bit just hearing, remembering those things. But yeah, the osteopathic medicine into orthopedics and in even primary care. I mean, it's a very natural flow. So I didn't try to go to any allopathic school. Like when I started at Mercyhurst, allopathic medicine to me was not what I wanted
Right.
to do. And so when I learned about osteopathic medicine, I was like, oh, I can still picture sitting on my parents' gateway. Is that a computer?
Yeah.
Gateway?
Yeah, I
Was
think
that
so.
right? In this huge monitor that was like this big
And it was
in our
deep,
old
right?
house
It
in
wasn't like the
Rockaway.
flat screen that our kids see.
Oh, it was
Heavy.
huge. No, it was huge. And reading emails from Amy Kerner at the time about osteopathic medicine, thinking, "Oh man, this is perfect." Certain memories you just can picture it perfectly, like it happened yesterday.
Yeah. So my last kind of business question for you, Greg, is one thing that I'm like very proud of you for, and I think it's pretty unusual, is when you came out of your fellowship in 2008, I believe it was.
Nine.
Okay, so 2009. You've been you've been in Blacksburg since 2008. You did your fellowship there. Then right after that,
Right.
you've been in the same practice since day one out of fellowship.
Yep.
That is a very, very, very rare feat that you just don't hear about these days. If like, what have been the secrets to that? Like, talk a little bit more about your practice too, like the MDVIP component of your practice. Like, what's a typical week look like for you, and what have been some of the? It's a two-part question. Typical week, because you do different things, right? You're not just a sports med doctor. You're a full-time primary care internal medicine doctor. What's that week look like? And what have been the secrets to your success with staying in one place, one practice for that entire time?
Well, that's how long do we have?
Yeah,
No,
about 3 minutes.
So go. No, I mean, I appreciate that question. I don't even know if I think about it. Hearing you say that makes me
You should be very proud of that.
maybe more how rare it probably is for that. And, I think we've both been very blessed, fortunate, made good decisions, right? So it's not just getting lucky, but part of that is being in the right place at the right time, but also being willing to take those risks, have a huge med school loan or move away from home or go to here, or go there. So, I mean, it's been a combination of good decisions, but the opportunities being there, and being fortunate by some pretty awesome opportunities. So coming out of fellowship from Susan and I are pretty boringly similar. We have such similar interests, and I think about, we could build a house in a week by making choices. Like, we agree on colors and poles and all of those things. So we decided that we wanted to live in the Mid-Atlantic basically after fellowship. And so I was fortunate, I think, getting into Philadelphia Osteopathic School, getting into internal medicine at Christiana. I really only wanted to do my primary care sports medicine fellowship at Virginia Tech. I think my secondary, just to put Dr. Gunnar Brolinson's name in there. I mean, he was definitely my sports med mentor and has been as I've been down at Virginia Tech. So he was the program director at Virginia Tech.
Love those shout outs too, by the way, Greg.
The only program. Yep. He's probably watched all your podcasts.
If you didn't bring him up, I was going to ask.
Anyway,
him, but yeah.
Yeah. So yeah, he was, my fellowship year, and probably even my third year in residency, he and I connected, and the first 5 years or so, and his job and role has changed a little bit, so he's not as active at Virginia Tech now. But he was definitely my Virginia Tech mentor, and just someone I could always go to, and I can now still. But I was in the right place at the right time after the fellowship. There were a couple team doctors that had left, and so I got offered a job to stay on board at Virginia Tech as one of the head team physicians at 29 years old. I mean, it was just an amazing opportunity. I didn't plan on that happening, but we loved Blacksburg. I mean, I think that being in the right community, the right geographic place, Virginia Tech, and the way they operate in just a high integrity. You'll never hear about Virginia Tech being in the news about sign stealing or recruitment violations, they just do things the right way. And I think that's been very, very important to me. So I was in the right place at the right time for the Virginia Tech position. When I went out into interviewing for real jobs, because really the Virginia Tech position, I call it a hobby job. I mean, it's I go there Tuesday and Thursday afternoons for 3.5 hours. I cover women's soccer in the fall and men's basketball now in the winter. It's really a hobby job. I mean, I enjoy it. It's fun. My wife loves sports. My two boys love sports. So it's able to be done, but it doesn't pay the bills. And so again, right place, right time. I went to one interview for my real job, and it was with this group called Medical Associates of Southwest Virginia. It's a practice that was started in 1974 by basically three doctors, Slayton, Birch, and Payne.
Sounds like a
Dr.
law firm.
Payne was still, I know, yep, LLC. Slayton, Birch, and Payne. A bunch of, long, many years of many different docs coming and going, but basically the core foundation were those three, and Dr. Payne was still there in 2009, and so he was one of the founding docs. And I went there, and the location's great. They own the building. The building's right basically next to the hospital, about 2 miles from Virginia Tech. And I saw an opportunity to become an owner. Its independent practice was very important to me. One of the cornerstones of Medical Associates, they took care of their patients in the hospital and admitted their own, were basically the hospitalists of their own patients. I love that as an internist. I was one of the rare. It's just, I think a lot of people don't really want to do what I like to do anymore, which is fine, which makes it easier for me to kind of stick out. So from the get-go in 2009, I was a junior partner. I wasn't an owner or partner, but I did my time and admitted my own patients in the morning, and actually took community call as well. We did 5 nights of call a month for about 5 years. Just nuts and bolts traditional internal medicine. I go into the hospital at 7, round on my patients till 9 or 9:30. Start seeing patients in the office. Just walk 100 yards to my office. That's huge. That's a big component to being able to do what I do. Is you can't be spending time in your car all the time.
So you still spend a
Commuting and
fair amount
driving,
of a couple hours every morning in the hospital?
So it's different now.
Okay.
It's different now. But so Dr. Payne retired in 2013. I became the owner. So I was the sole owner for 5 to 7 years
Of that
and then
practice. What was it called?
Medical Associates of Southwest Virginia. Dr. Maggie Belton joined the practice in 2012, and we are now 50-50 owners. So she joined ownership, I think pre-COVID, probably 3 or 4 years ago. And it's her only job out of residency. She's a family.
So
med
she was
doc.
employed by you for that period
Correct.
until pre-COVID when she became an owner.
Yep.
Okay.
Correct. Yep. And so you and I have talked about this, a bunch. I just think our personalities are made for private practice, independent practice. I think that there is clear-cut data that physicians are more satisfied, happier in private practice in general. Working for yourself, working for your patients, working for your staff. And I was just really fortunate that Medical Associates needed another physician at that time. I didn't interview anywhere else. I mean, I just felt right. I mean, it felt right. And so one of the big sticking points, and it was not a question for Dr. Payne and office management staff, was that I needed to be able to go to Virginia Tech Tuesday and Thursday afternoons to be a team physician at Virginia Tech. So typically a physician's going to have a half day off a week for admin or golfing or whatever you want to call it. My half day, I go to Virginia Tech, and then I take another half day away from Medical Associates to go to Virginia Tech.
Okay.
And that was just part of the deal. I mean, that was just part of, they needed me, in 2009. I mean, they had a couple openings and needed another doctor. And that was just part of the deal. And we fast forward 15 years and I'm still doing the same schedule, going to Virginia Tech Tuesday, Thursday afternoons. And it's worked out great. So Tuesday and Thursday, my Virginia Tech team physician colleagues are at VCOM, the Virginia College of Osteopathic Medicine, just right down the road. They're there teaching the OMM lecture and labs. So they didn't even have anyone. They didn't have clinic at Virginia Tech Tuesday and Thursday afternoons.
So that worked out perfectly.
When I was a fellow, it just, I just kind of fell right in there. And I'm the only non-VCOM employed team physician. But it works out great, I think.
Yeah.
So then you want me to talk about the MDVIP?
Yeah. Before you go into that though, I don't want to forget about this. So, Travis and I actually, it's like when you have one podcast, it's not good enough. You might as well start a second. So we actually started a second one we've recorded our first episode, just after Christmas, actually just before Christmas, but it will air, January 17th. It's called Red Carpet Healthcare Solutions, and the title of the podcast is Private Practice Podcaster. So the entire reason for the podcast, the message, the mission is to kind of spread the word of private practice because, as you and I both know, that pendulum has swung so far to the employed model. And I know of so many, and just in the orthopedic field, but other fields as well, that are very frustrated with that. And they're looking, how do I do this? And it can be daunting. I mean, you kind of, I don't want to say fell into it, but the timing was right. The location was right.
You can.
Like mine was a little different. I started my private practice from scratch. It wasn't something that I really kind of inherited. So a little bit, I mean, some of the volume was there, but not the infrastructure. I had to create that from scratch,
Yeah.
which it can be daunting. And quite honestly, I would not have been able to do right out of, residency or fellowship. I needed years to
Right.
practice as a
Right.
clinician, but I
Yep.
would love to have you as a guest on that as well, because I do think you will have so much to offer from that. And I think it segues into what you're going to talk about with MDVIP, because there's going to be a component of red carpet that we are teaching others how to a little different style of your concierge practice versus mine. But say, as an orthopedic surgeon, how would you be able to start a concierge practice? So to tell us about MDVIP and what that is and how it works for you.
Yeah, and I don't want to get people too complicated in how it happened in general, but basically in 2016, I was drowning and maybe didn't even know it. As a resident, as a young physician, I was just taught to say yes. If someone needs to be seen, put them on, yes. If I need to do a consult, yes. If you want to be on a committee, yes. Um, that's I don't regret that, but maybe it didn't. I mean, I literally never said no to someone coming in. So I was drowning a little bit in 2016 before a gentleman from MDVIP just cold called me, just showed up in my office one day. His name is Tim. And I remember meeting Tim thinking that he's a salesman. Like, I don't know. I don't have time. I mean, I'm seeing
So you were
25
about
to
to say
30
no
patients
for
a
your first
day.
time?
Oh, yeah, I did say no. I did. Yeah. Like to this guy. Right. I get it. Um, so Tim had to wear on me a few times, wear me down. I mean, it was. I thought I was doing what I was supposed to be doing. 5 to 6 patients in the hospital, and 25 in the office. And Virginia Tech, I would go to nursing homes, make rounds at the nursing facilities,
Just grinding
rehab.
every day.
Doing ICU, doing vents, right, taking night call, doing weekends, and it just was the way it was. I wasn't looking for a different model. I didn't even know of a different model. I wasn't looking for it. And so Tim showed up at my office, and I blew him off. Oh, we're having a dinner in Roanoke. We'd love for you to come, just learn about MDVIP. I'm like, no, I'm not interested. So he came back and gave me a handout and said, listen, doc, we're doing this. No, the dinner. So he was doing another dinner in Roanoke. And I said, Tim, I can't do it. And he's like, well, why don't you call me? I'm going to Napa, California next week for a national conference. And then I'll be back and we'll hook up then. And I said, oh, you're going to Napa? I'm going to Napa. And so we were, I guess, again, it's just right
Fate.
place, right time, signs, whatever. Yeah, fate. I mean, I don't want to be melodramatic, but it's true. So Susan and I were going to Napa for our 10-year wedding anniversary in 2016. The same weekend that they had their national, or it wasn't the national conference, it was a big recruiting conference. And so I thought this was weird. We'll go meet you for a drink in Napa. And so we met Tim and his boss in Napa, and let them buy us a $18 glass of wine. And, it was just,
Some pretty
I
shitty
did
wine.
my due diligence. A glass.
I'm kidding.
Nothing
Yeah,
shitty
no, I'm
out there.
kidding.
You know that. So, yeah, I mean, I did my homework. I went to some conferences, did my due diligence. And the long story short is I'm 6 years now. So I didn't open my practice until basically technically December 27th of 2017. So I've now completed 6 years being affiliated with MDVIP. So MDVIP stands for Medical Doctors Value in Prevention. I think of it as a personalized primary care model or practice. So I used to have about 2,500 patients in primary care, and I currently have 400. The 400 patients have an annual membership fee to be in my practice. It's sort of being part of the Beato club kind of thing. So it's my current annual fee is $1,800.
Would you charge me that
a month.
amount, or would you give me a little bit of a discount? Or are you going to charge me double?
Oh, you would be double. Yeah. Yes. The amount of work I would need to do. But no, I mean, everybody pays the same amount. Everybody gets a real thorough physical once a year with extra testing. There's a lot of focus on cardiovascular disease, chronic inflammation. I feel like MDVIP has allowed me to, I mean, clearly spend more time with each patient. So I see about 8 patients a day, maybe 7 to 10 patients a day instead of 20 to 25. I still admit my own patients. So just if the 400, any of the 400 MDVIP patients need to be admitted to my hospital, which is, again, right next door, I will admit them, or I'll have the hospitalist admit them, but I will take care of them throughout the hospital stay. But we do a really good job, I hope, of keeping people from the hospital because I get people in right away. I mean, if someone emailed me tonight, like, man, I slipped on the ice and I twisted my ankle, I'd give them a time to come in tomorrow to see me. So I think the MDVIP model has really allowed me to focus my attention on a smaller amount of patients. And those are biased patients, right? Those are patients that are paying extra money to get more health care. So they're typically motivated
or better
not
quality,
100%,
right? And more
better quality,
and
right? I mean, there's a
direct
lot of
access
super
to
healthy
their
patients
physician and all of that
that want
Yeah.
more. Yeah. So all my patients have my cell phone number. For emergencies, we have a secure portal that I check emails nonstop. MDVIP is a national company. There's about 1,100 MDVIP affiliated physicians throughout the country. It's centered in Boca Raton, Florida. There's definitely more MDVIP doctors around bigger cities, but I'm a huge believer in it. I think I'm a more well-trained, well-versed, well-rounded physician. I don't miss things anymore because I have more time. MDVIP is a support system. They don't own my practice. It's an affiliation agreement.
So again, you definitely need to come on the red carpet one because we could talk about this for probably 2 hours. I don't want to get too far off track, but that would be the perfect venue for that. My last kind of question, and I know this is more than I was allotted, but it's my podcast, so I can do that.
Yeah.
Just before I forget this, is you said you went from like 2,500 patients or so down to 400. So how did that transition occur? And did you have to find somebody else to take care of them? Did your partner Maggie take that load on, or how did that work?
Yeah, good question. I mean, that was this was a really hard decision.
I'm sure it was. It's a lifestyle change.
Well, no one in this area does this. There's one physician that has a kind of small direct primary care practice, but there's no outside the box kind of thing. So there were a lot of raised eyebrows and concerns and worries from patients. And my office staff, I mean, I wasn't 100% sure I'd have enough people sign up. After 2 weeks, I knew I would have enough. But, there was a lot of uncertainties. My office manager, Amber, I mean, there were a lot of uncertainties. So it was a huge decision. I don't love thinking back on that, but I love the decision. Again, like you asked, earlier, I mean, it's about being in the right place at the right time, but also being able to make that decision. And I'm really happy that I made that decision. So the transition period was really difficult.
Yeah, I'm sure because
there were a lot of patients
disappointed, right?
Good. Disappointed, almost angry. Yeah. I mean, they thought I was abandoning them. There are patients that to this day, I think, didn't give it enough time to really learn about it, but that are still upset with me about it. I mean, I get, I don't know, upset, but disappointed. I have a fair amount of younger patients, 20, 30-year-olds that every so often I'll see nurses. And so at the hospital, and, they give me the business about, man, I wish I could still see you, but now you're in this bougie practice or you're in this VIP only practice. And I'm like, I get it. The fee is basically $4 a day, and so it's not like it's $10,000 or $100,000,
right. Which I think it could be a lot more. Quite honestly,
I'm worrying about that.
I think that's undervalued.
Yeah. I mean, I think so. I still bill insurance. I still, if you come in for a sick visit, if you're admitted to the hospital, it's a
Sure.
hybrid kind of financial situation. But the transition period was very difficult. So the majority of my patients stayed in our practice. So at the time of my transition, Dr. Belton was just ramping up. She had room. So she currently is very full and
She does not
successful,
do
largely in
MDVIP?
my opinion. No, she's got her normal high volume, fee for service practice. So she was not full when I joined MDVIP. So she absorbed a good amount of the 2,200 or so patients, and that has helped her, springboarded her into the positives for sure. We had a couple mid levels as well that absorbed some of the patients, and then a bunch of them, not many, maybe 10% went to other
Gotcha.
practices. But it has worked out, really well. I'm really happy with it, and it's really allowed me to expand my practice. I'm learning more and more about longevity. Trying to talk more about long-term health, not just focus on the here and the now. I think MDVIP has allowed me. They have a whole medical advisory board that reviews literature, new technology, new testing. And then, a lot of it, they say it's not ready. And then a bunch of it they bring to us affiliates. And I've added a bunch of testing that I think is
Do you
extremely
call those executive physicals
beneficial
that you're
to
doing,
patients.
those yearly ones?
Basically, yep.
Do you know about
Yep.
Life? Have you heard the book Life Force by Tony Robbins?
Yeah, I've read it. A lot of what he talks about is MDVIP. Philosophically, taking ownership of your own practice, of your own life. I mean, of your own health. Don't wait for a doctor to say, "Oh, you should do this." Early on in my MDVIP life, I really stopped saying, "Oh, insurance won't cover it, so you can't do it." Like, that's baloney. Tony Robbins talks about that. I actually had a patient go down to his Foundation Life clinic in Naples. I think it's in Naples.
Yeah, they've got.
And do that full physical.
So two of my good buddies and business colleagues both went down there for that. They do have a location in Pittsburgh, but I think it's the one in Florida. There's like 4 or 5. So I did I'm an orthopedic surgeon, so I can't really read too well. So I did the audiobook version of it. But you know me, I have a ton of time in the car every day for my commutes, and it's a great book. So Jay, if you could put that like right here, just the Life Force.
Well, I want Jay to put up Dr. Peter Attia.
Yeah, I was just reading stuff about him yesterday.
Yeah, you need to get on his. He's got his. So his book is called Outlive, and he is a prolific podcaster.
Yeah.
His podcast is called The Drive.
Yep, I know
it. He is my hero. Tony Robbins is. Patient brought Life Force to me, asked me to read it. I said okay, and it's the book. It's like, well, no, you don't.
No,
it's
I actually have
pages,
both. I have the book and I did the audiobook, but yeah.
Okay. It's like Tommy Boy, left to right.
No, I think you need to have the book because there's a lot of like charts and graphs that he references that if you just did the audiobook, they're like, refer to this, and you wouldn't know what's going on. So that's why I bought the book too.
Yeah, so Life Force was great. I mean, I learned a bunch. I mean, I think some of what Tony talks about in there is not ready for prime time. I think there's a lot in there that is. I do the Gallery blood test for the early detection of cancer. I'm a big believer in the Clearly coronary CTA for heart health and vascular health, and he talks about both of those. But Tony's and then Dr. Attia's book Outlive are in the similar realm of taking ownership, diet and exercise, nutrition, spirituality, sleep, relationships, being proactive, not waiting for someone else to tell you what to do. Dr. Attia is so smart, and
I got introduced to him in 2010
he doesn't just
by my good buddy Blake Miller, orthopedic surgeon, trauma surgeon that was 3 years younger than me. I was actually his chief resident, and he was the one that really started talking to me about ketosis and keto type diets, and started kind of throwing out the terms intermittent fasting and things like that. So yeah, Peter Attia, he's a stud in this world.
Yeah, he's my hero. Yeah, he's my hero.
So personal stuff. So
I'm ready.
you have a beautiful wife, Susan. You have two beautiful, awesome, young, active boys, Marco and Dominic. What do you guys? Again, Blacksburg is kind of a seasonal area, so you're probably not getting snow. And if you do get snow, it's not too thick. What are some of kind of your Chris? We just came out of the Christmas season, Christmas/New Year's traditions that you guys do together as a family.
Yeah, I think it's the holidays are different now, and part of this is a little I don't want to say emotional for me, but it's a little bit different. I feel like very much a family guy. I'm a husband. I'm a father. First, I love hanging out with my family. My we don't have any family in Blacksburg. We know to as I was thinking, when you were saying about taking your boys, one boy and going somewhere, we have to get a babysitter. We have to get someone to stay.
So
The
Karen
night.
doesn't
So
go
if
with
it was
me,
just
by the
me,
way. It's just
oh,
no,
Karen doesn't go.
it's just
Okay,
me.
now we're
Yeah.
talking.
Now I think you could do it, right?
Okay,
It's a daddy
but
son
yeah,
date.
yep. Okay, I got you. So, but either way, the holiday traditions are not the same as they were when I was growing up. When I grew up, we'd always have 20, 30 Beatos and fields and family, family get-togethers, and so, but I've seen my parents get older. We've all gotten older, right? But so we're having some family health issues, and sort of reminded me like, man, I'm not up in Rochester. The holidays. It was great to be able to get up there, but I haven't normally done that. We have our family. The four of us here in
Yeah, you're
Blacksburg, and
creating your own new
um,
traditions.
you know, creating our new traditions, but still having to keep in mind family and those old traditions. So the current sort of standard tradition to get together with Susan's family every other. We kind of alternate Thanksgiving and New Year's, and so that's brought us to Erie a few times over the last 10 years, and then down to Florida alternating years. So it's always great to get the cousins together, and this year we hosted Thanksgiving. So that was, to answer your question. I mean, this year we had all three of Susan's sisters, and your number one fan and his wife here in town for a few nights, and that was super great. So it's great to have that always every winter time. We know we're going to have the Ghanem crew together, um, which is fun. New Year's Eve. I've never been a big New Year's
Yeah.
Eve guy. I'm not sure I made it to midnight in college, let alone at our grain age. I did this year because Marco was insistent. I don't. Did Anthony want to stay up? Did they insist on staying up?
So we were, same, Greg, never been huge into New Year's Eve. My family always had a party, like my parents. So I think you maybe have gone to one of those.
I
Yeah.
went 1 year. Yeah, I remember
So it
going
was
1 year.
mainly like my parents and friends from church at St. Hippolyte's. There's another shout out for you, Allie and Jay, to plug
Shout
in there.
out.
Maybe put a picture of St. Hippolyte's Church here. Just great people.
Shout
And,
out to Jesus.
but I never ever went anywhere for New Year's Eve. Never had the desire
Yeah.
to. It's just like, why?
Yeah.
I'd rather be
Agreed.
home and then I can just crawl
Yeah.
into bed. So this year, the past several years, we've gone to my good buddy Bill Spiros and his wife Amanda Spiros. They have 4 kids, and they would have maybe 4 or 5 couples over, and we'd do it there. We'd stay, and then we.
Do you only hang out with Greek people?
You would think so by this. He's not only a good friend,
Okay.
but he's like
Just
my
wondering.
my personal attorney too. So, and then his wife.
Oh, good, good. Keep your
Yeah.
attorney close.
And
Yeah,
his wife is,
especially you.
she does interior design work and stuff like that. She's helped me with projects over the years. But this year we finished our basement, which next time you're in the area, you'll have to stop by. So it's a great space.
Mm-hmm.
The boys are always down here. I had to close the door so that they wouldn't be at
Yeah.
the basketball hoop. But I'm in the wine room right now. So we decided, hey, we're going to do a party here this year now that we have this basement. So we actually invited the Spiros over. We invited the
Then you have to stay
well,
up.
so Stacy and Pete came out from Michigan. We did our thing, and I think we stayed up too late the night before. Pete and I, we were up till 2 a.m.
Uh,
and both
classic,
of us were sleeping
classic.
by 11 o'clock, and the Spiros has never made it over.
Yep,
So
yep, classic. Yeah, that first night, overdoing it the
yeah,
first
they
night.
came into town
That's classic.
Saturday, and we're like, "Hey, you want a cocktail?" And next thing you know, it just
Yep,
spiraled.
yep.
So
Next thing you know, it's 2 a.m. Yep. Yeah. So we don't usually do much for New Year's Eve, but a lot of the traditions of the Blacksburg Beatos surround traveling. Surround sports. Same thing. Dominic Day, Marco Day. We've done some pretty cool things. Gone to some neat places.
So I'm going to kind of steal your question to me, the travel question. So what do the Beato family, clan, whatever you want to call them, have in
Yeah.
store for 2024? Any big trips?
Yeah. Yeah. So Susan and I were just talking about this. We don't do well with planning full weeks. I personally, in my job, I like to do long weekends, 2 or 3 nights, Friday to Monday, in general. So we have a bunch. I mean, that's kind of like your, some games and things like that on
Yeah.
your trips. Susan and I, we've gotten into. I think this is really important. I think it's important to take time for yourself a little bit. And to me, golf is my one thing that I kind of do largely try to play once a week with my buddies and stuff. Obviously, the boys play, Susan plays, so that's nice as well. But the last few years, we've taken a trip, just Susan and me with another couple. And so we've been going to Sandals Resort. This will be our third year. We're going to Exuma in May for, I think, 5 nights. It's a golf resort that Beaches owns with a really, really great high-level golf course in Exuma.
Awesome.
So we're going with our neighbors, the Browns. So that'll be our third trip. The families went to Turks and Caicos a couple years ago. They have 2 kids about the same age as Dominic and Marco, and so the 8 of us went and shared a place. That was amazing, and we'll probably do that again. But the following year, we went to Jamaica, and then this year we're going to Exuma.
Nice.
I would say that's the only like big trip that we have planned. We've been one of the Christmas presents to the boys. We they don't want for much, which is great. But also, I don't believe in just spending money just to spend money. And when you ask your boys like, hey, what do you want for Christmas? And they don't have things readily, like I remember when I was growing up, I had a bunch of stuff. And so asking my kids this year, they were all, oh, I don't know. Dominic said, surprise me. And I'm like, really? We don't have a Christmas list? You don't have a list for Santa? No. And then Marco, said VR at the end. But so I decided to give them a list of activities, sort of like adventures or activities. So we named like 8 or 10, go to Busch Gardens, Great Wolf Lodge, go to a baseball game, NFL game, a list of about 8 things, and had them choose one. And so they've each chosen one. And so we're going to now we're working on the details. And so I was going to say earlier when we were talking about baseball, we may go to Pittsburgh for a Pirates-Cardinals baseball game. And I'll let you all know if it's on a weekend and, the stars align. We'd love to have the Mollies down, might get together with the Stemfers.
Yeah, they'd be fun.
Garrett and Tara, they've made it down to Blacksburg, actually.
Oh, Tara. Now I get you.
Had a great
Yeah.
time.
No,
Yeah,
that'd be cool.
had a great time.
We always do a Steelers game, and again, that's because Karen doesn't care. She went last 2 years ago. She didn't go this year to a Steelers game, but I take all the boys. That's collectively, and then Luca for his special day last year. We went to a Pirates game. Him and we spent the night down in Pittsburgh. So.
Yeah, PNC Park is super fun. We've been there before, but the Marco and Dominic haven't. So I think Dominic chose a major league game, and I think Marco wants to go to Great Wolf Lodge. Do you know
Yeah.
Great Wolf
Yep.
Lodge?
Are there more of those, or is it
It's
just the one
indoor water
that's
park?
in Ohio?
There's a bunch. No, there's a
Okay.
bunch of them. There's one in Williamsburg. There's one in Charlotte. Those are the 2 closest. But we're not necessarily married to going either of those. I actually think there's some sort of water park, Great Wolf Lodge like hotel in Pittsburgh. So we were thinking about maybe making it 2 or 3 nights and doing both of those. But
Yeah.
so yeah, we don't. When the fall starts, so I start covering women's soccer end of August, and then really covering soccer and basketball. We don't really. I don't like to miss too much of
Right.
those games. I'm not against missing one or so, but I can't miss much. We'll do a golf trip. My buddies will do we call it top 100, 8-person golf trip in the early fall. And I'm planning that one this year.
Better get on it.
Haven't picked the choice. Yeah, I haven't picked the destination yet. We went to Pebble Beach a couple months ago. That was
Nice.
amazing. For 2023's top 100.
So my last personal
Yep.
question is kind of going back to Italy, our trip there. What was, if you could just go through your whole family, if you know them, but like, what was your favorite memory from that trip, your favorite location, meal, whatever it may be, Susan, and then Marco and Dominic? I think I know one of them at least. Probably yours.
Well, obviously golfing at Marco
Yeah.
Simone golf course. That's a low riding fruit.
Yeah.
I mean, that was special. I mean, watching the Ryder Cup about a year later
With your house and my house,
son's
I
name
said,
is
I was like,
Marco.
yeah, I'm going to buy this one. Greg,
Yep.
you can buy that
Yep.
one.
Yeah. Well, the golf course looked a lot different
It did.
when they played the tournament. Thankfully, because it was obviously not ready when we
Right.
played it. But that was pretty special. I mean, my son Marco, Marco Simone, he had a great time. That was just really neat. As a big golfer.
You know, it'd be kind of cool. Jay, you'll be listening. Marco's a pretty good little golfer. Obviously, Jay is a very, very good golfer. I mean, he was a golf pro there for years. If you have any videos of Marco just swinging a club, because he's got a great, beautiful swing, send that to Jay as one of the assets, because he'll ask you for stuff, and put that in there, because that would be really cool.
Yeah.
You may even have one from Marco,
we've got some pictures for
from
sure.
Marco Simone.
Oh yeah, Marco
That'd be a
Simone.
kind of cool one.
Yep, absolutely. Yeah, that was a neat. I mean, I'll never forget the language barrier of trying to get. Are we riding? Are we walking? If we're walking, we need some sort of trolley. They call them trolleys, and then we get then Dr. Molly, of course, pays for the upgrade of the remote controlled trolley, and I think Marco might have been more excited about using that than the golf. But
well, I didn't want to walk to begin with, and then they didn't have enough carts. Right? They were like out of carts.
And that's a European thing. I mean, they don't usually use carts. I'm on like a listserv on Facebook, and someone wrote something about a rain delay or cart path only. Like such and such. Don't you think that when you check in, they should tell you before you pay that it's cart path only? And some guy wrote in, he's like, I'm from England. What does cart path only mean? Because they don't have carts. Like they don't. That's not a thing. So anyway, I mean, that was a great moment, but not, that was a unique opportunity, and we almost weren't able to play because they aerated, and so that was cool. I really enjoyed the dinners that we had sort of
At the houses,
catered or made, and the one that was the best, and I feel like the views are Amalfi and all three. I mean, it was amazing. Obviously, the Rome house didn't have much of a view, but that food, that spread was amazing. Rome is a very busy, a lot of graffiti. Like it's unfortunate that it's sort of turned into this big city. But you and I, we haven't talked a lot about Rome, but I really had a great time at that dinner. I'll never forget the outdoor seating at the other two places.
You and I sat next to each other. I've got a photo. It's actually, when you watch your podcast, it's the photo of you and I in that podcast. It plays every time at the beginning of my podcast. And that was one of my favorite dinners.
In Rome?
Yep.
Which
the last night that we were there and we went out to dinner.
Yep.
We had
Yep.
that really, really long
And,
table, and
yep.
it was cool.
Yep. Yep. And Italy is just special in general, and I know the quest on for your family. I actually when we were sitting in here and talking about that, I kind of was like, all right, that'll be good, But I thought with the mayor and the old mayor coming, like that was just the way it worked out. You couldn't have planned it better. Like obviously you planned a bunch,
Yeah.
but the way it worked out was just nuts. I mean, you were talking to people. We were at that
Well, I
corner.
mean, they had my
You know,
grandfather coming from a totally different town. They're
you,
like, "Nah, he's not from here. He's not from here." And then we got into those old ledgers and books, and I'll include that, Jay. There's a photo of, as Greg's referring to, the current mayor of Comano and the previous mayor from Comano, whose last name is Leary, Leri, and that is my grandmother's maiden name. So there's definitely got to be some type of connection. And then when we got up into the mountains, or even there, we saw my great grandfather's, um, you know, not his tombstone, but what would you call that? Like a mausoleum, like plaque.
yeah, yeah,
We saw that, and there
yeah.
was a photo of him on there, and that's really what connected it, because I showed a photo of that to Cesare Leary, and he says, "I know this man. I know where he lived. I've been in his house." And prior to me showing him that little photo that my cousin sent me, I think we were at a dead end. And that lunch, I think, was one of my
Oh, I didn't. I don't think I realized
yeah.
that. But yeah, that lunch was amazing. I mean, we could still be there eating
Yeah, we wouldn't fit
right
out the
now.
doors, but the food was just amazing there. And then I kind of liked my time. You and we went to Cinque Terre. We had a day to hike with Giacomo. I should probably check on him, make sure he's
Oh
still
yeah,
with us,
yeah, yeah,
walking up
yeah.
all those steps. But
You better hope he is.
what about
Yeah, that was pretty neat.
Susan and the boys? What did they like?
Oh man, I mean, I know Dominic would say pizza and gelato. That one's pretty easy. Marco, and they love throwing the football. Even though every single time we went out there, it ended in tears and
You're gonna get
arguments.
that
But
with
that's
5
just
boys
standard
their
boy.
age.
That's just standard. Well, I get it with 2
Yeah,
boys, so that's standard operating procedure for that. But I mean, going to throwing and playing, throwing the football and playing football
the
on.
Borghese Gardens.
Oh man, now yeah,
Yeah,
yeah, yeah.
we'll have to put a
Borghese.
photo from that in there,
Um,
because that was
that's
freaking amazing. We're playing where they used to have like chariot and horse races. I mean, this is thousands of years old. This isn't like 50 years old like here in the United States.
yeah,
That was really cool.
yeah. That was Americans, stupid Americans invading ancient Rome, Roman gardens. But that was really fun. I mean, Marco loves doing that for sure. Susan, what would Susan say? I mean, I know she loved Amalfi and Cinque Terre and just the scenery and the train trips. We one of my memories is coming from the top of
Po- Positano?
Positiano, Positano down to Amalfi, like through that
Oh no,
very
Positano was
steep
where we had lunch, where we saw Denzel. We stayed up in Ravello. We walked from Ravello down in
Ravello.
yeah.
Yeah. Ravello
And
down.
by the
Yeah.
way, if you guys haven't
Um,
watched it yet, you and Susan, I sent you guys that photo
we,
from
oh,
what's the Denzel movie? Not
the
I
Energizer.
was going to say Expendables. No, that's Sylvester Stallone, not Energizer Bunny. Equalizer 3.
Equalizer.
Yeah, that
Yeah.
church that we walked into, kind of when we got almost down to the ground level. Remember we looked in there?
Oh yeah.
That
Yeah.
that
Yeah.
church is shown so many different times,
That was in
and
there.
there's scenes inside it.
Oh.
And then we have I took a
Oh.
picture of your family with that in the background. I took a picture of, or you
Yep.
guys took a picture of our family with that in the background. That was a really cool little. It felt
Yeah.
like we were never going to come to the bottom of the stairs.
Yeah, I know that would not probably be her favorite memory of struggling down there. She was kind of had a bum knee uh, in that. But she loves gelato. She loves wine. She loves eating the new things that she hadn't done before. Certainly, I don't think she'd been to Amalfi or Mount Vesuvius in Pompeii. I mean, that was pretty unique. So
Yeah.
yep.
Well, so Greg, we're going to get into what we call the seventh inning Sawbones shoe stretch. So people that know
All
me
right.
know that I'm a bit of a sneakerhead, particularly Jordan sneakers. So what are you wearing, Greg? What do you got on tonight?
Well, so I thought long and hard about this. Actually, not really. It was very very easy. So
Golf shoes.
the well, Susan did buy me a pair of Jordan Low golf shoes. I think very similar to what you wore at Marco Simone, but I haven't worn them
Okay.
yet, so I didn't wear them. One of the trends in basketball for ACC and I think in business is wearing sort of dress sneakers to work, or sneakers, dress shoes, dress sneakers to basketball games. And so I got the Jordan Low.
Oh, those are the Bordeaux's.
Yeah, Bordeaux is very good with the
Yeah, I
gray.
have that pair.
And the significance to me, when I was growing up, and I know you're the same way. Jordans came out, and they were. I didn't even ask my parents
No,
for that. I mean,
no
it
one's
wasn't even
spending
like,
at that
it wasn't
time
even an
125
option.
bucks for sneakers. The rich kids got those.
Yeah,
but
it wasn't
no.
an option. I don't even know that I knew anyone that had them, honestly, in the late 80s, early 90s.
Jared Oakes and Nathan Smith
and-
were the only two people that I knew.
Jared was about the only one. Yep. He had multiple pairs. But so as a team doc for men's basketball and just kind of I love shoes. I love clothes in general. I mean, I might have 150 golf shirts. I can use that as an excuse to buy some fancy shoes, because I gotta look good at the basketball games. These are the Bordeaux colors, kind of Virginia Tech, sort of that Chicago maroon. So I feel like these shoes tie together a bunch of different aspects of sort of my fascination with Jordans, but never had a pair. I forget that discount Payless.
Yeah.
You ever go to
Oh, yeah.
Payless? I had the blacks, like Jordan 5s or something like that, with the black and the red on the pat. They were like $13 at Payless.
So you did have a pair of Jordans that you bought at Payless?
They were not Jordans. They were like Bordens.
Jordache
They were like,
is what we call those.
yeah, they were Jordans with a G-O-R. But no, I just, in all kidding aside, like, we've come a long ways where we can, these still they're not $500
Sure.
Jordans, but they're not cheap. And, it ties together kind of where we've been, where we're going, where we're at, and being able to wear them for basketball games. And, I wear a few other kind of dress sneakers to work at times. And, it's still a little bit of a problem buying too many shoes, but I'm talking to you, so what could
Yeah,
be too
exactly. I
Maybe need to have Susan talk to Karen and you about what's too
yeah.
many.
Well, I've still got some open bins, so we aren't at the too many stage yet. I don't have to order new bins, but
I don't, but my bins, it's a bin problem. That's not a shoe problem.
so
I don't have enough
I'm
bins.
over 50 with my Jordans now. But yeah, I have the Bordeaux's. I think I'm at like 52, Greg. Yeah, it's bad. But so I'm also wearing a pair of Jordan 1s, lows. He's still check his blood pressure, folks.
You said 52, right?
Like a deck of cards.
Okay. And you tell people that. Okay.
These are Jordan 1 lows.
Are they
No,
orange?
these are the reverse
red?
bread. So bread just means black, red, the kind of the Chicago colorway.
Oh.
And it's just the inversion of what the original was when they came out. So these are the reverse breads, and yeah, they're comfy. So I love the whole Jordan line. We've talked about it many times, but huge influence for kind of both of us, the era that we grew up. I really do attribute. I've had a lot of people ask me about my fascination with Michael Jordan, and you know, it was, yes, he was awesome on the court, but it was his competitiveness. And even today, I was coaching one of Tino's teams, and after the game, Karen came over and she goes, "Should we check your blood pressure?" And I'm like,
No.
I'm like, you're gonna want to give it a couple minutes, and like it or love it or hate it. I'm a pretty high energy guy. I'm passionate, and that's my style. And to be anything other than that would not be genuine or authentic. And I'm
Yeah.
proud of these little guys. They're 4-0. They're playing really well. They're playing well as a team, moving the ball, and just playing really good defense too.
Do they pass?
They,
Do your kids pass the
they
ball?
do. We've put in not a ton of complicated plays, but more to learn concepts like emotion offense, just like the concepts of picking and rolling, right? Just like classic fundamental
Yeah.
basketball.
Keep it
Yep.
simple.
The KISS
Yep.
principle. So
So let me ask you this: do you have a VHS player in your house? Are you able to watch a video
I
currently?
I think up until recently I would have been able to say yes, but we purged so much stuff when we finished our basement because it was all storage. And
The reason I ask is, you're talking about Jordan. When I was home in Rochester, my parents have like 4 of them and like hundreds of videotapes. And my dad's like, "Oh, go look at what take whatever you want." I'm like, "Dad, I can't play these."
you should get
So
it
I look
converted.
at them, and well, he has a thing that converts them too.
Yeah.
So anyway, but they don't throw anything
Yeah,
away.
neither do my parents.
Like, that's just a thing. So anyway, so Marco and I were down there, and I'm like, I'm gonna hook up this VHS, and because I open up this bin, and Come Fly With Me, original
Oh,
Michael
dang,
Jordan,
dog.
Come Fly With Me is there, and I'm like, I'm watching this. You are watching
Yeah.
this. So I had to go through like 2 of the 3 VCRs are broken. I'm like, "Dad, why do you have this?" Is the one that we had, like the original from 1982.
Where the
Throw it away.
cord for the remote physically, or
It
as
had a
cord.
corded remote.
Yeah.
Yeah, a corded remote. I gave this to Marco. I said, "What do you think this is?" So anyway, so we watched watched 75% probably of Come Fly With Me. I had the Larry Bird and Red Auerbach teaching fundamentals of basketball. I don't know if you ever
I
watched
did.
that one.
That's a great one.
And then the second Michael Jordan
Just Space Jam.
video. No, there was another Michael Jordan like highlight reel video that came after Come Fly With
Okay.
Me. So we had that one as well. But yeah, those are just, I watched those dozens and dozens
Yeah,
of
I'm
times.
surprised they
And-
still
and
work
wanted
because you
Marco
probably
to
wore them
sit
out
through that.
while you were a kid.
Yeah, it did. It did. They all did. It was crazy.
Yeah.
So
Well, Greg, again, normally we would kind of do the Sawbones Challenge, which would be fun, especially with you because you're competitive, I'm competitive. Typically, what we would do in the past,
I still want to do it. Let's do something.
well, we'll do something, but it won't be physically competitive. But like, unless you got a basketball hoop there, and we can play like virtual pig, and you shoot on one hoop, I shoot on one hoop. He's looking around.
It's a little
Yeah.
dark. It's a little dark. I do.
So one thing that I've done in the past for the Sawbones Challenge to make it a little bit more fun, and you're an NBA guy, I'm an NBA guy, at least we're at one point. What we've done is kind of like virtual lineups. And my first buddy, Bill Spiros, he was so unfair about it. He's like, I'm going to name my top 5, and they had to be like positional players, right? And then I had to pick mine. I'm like, well, you picked all the top 5, and now I have to.
Right. You got to go every other.
So I'm as the guest, I'm going to let you pick first. We'll go through each of the positions, point guard through center, and you can play like small ball if you want to, but you have to remember that whoever you pick for, say, your point guard has to match up against my point guard. So you may think, well, this is a great point guard, but would they really match up well against who I'm going to pick?
Any era?
Oh yeah,
Like
any
all
era.
time?
So they could be alive, dead, current, retired, whatever. But you go first with point guard.
Okay. So I think we're both a little traditionalists in a lot of this, aka old. I like a point guard that distributes and is a great shooter. but distributes. I like a pass first point guard.
Okay.
Um,
I think it's fun if I say who you're not going to choose then. You're not going to pick Magic Johnson because he couldn't shoot that well, but he
Right.
was pass first. And you're not going to pick
Yep.
Steph Curry because he can pass, but he's a shoot first
Yep.
point guard. So who you picking,
yeah, and I
Bob
don't even
Cousy?
know if I consider him a point guard. Well, he's good. I know how he died.
I didn't realize that he died. I thought he was.
Oh yeah, he died. He had a heart attack in a YMCA gym when he.
You're
was in
not
his
centered in the camera though,
50s.
Greg.
Yeah, I'm just thinking. I'm struggling right here. I want to. This is very important.
First pick out of the gates.
John Stockton has never been a first pick.
Never. And we've done this a lot
in
of
his
times.
life.
His name's never been mentioned ever.
Yeah.
Solid defender. Pass first for sure, but he could hit the three, right? If he's open, he's dangerous.
I'm a big fan of his distributing because there's only one ball.
Yeah. Yep. This is going to take longer than your MD VIP or your osteopathic.
Yeah. Well, I'm used to going slow. I've slowed down big time. I'm going to take.
He's on his computer
I'm
looking
gonna
up best
take,
point guards of all time right now.
No. I'm going to take John Stockton.
Okay. I'm going Steph Curry.
I'm writing him down.
I'm going Steph Curry. And then what Jay will do is he'll actually put them up here, kind of side by side, And
I figured you would take MJ just so that as a point guard. I'm
going to try to stick to like most natural position for the players.
Positions.
Okay. But again, I'm a huge Steph fan. I would agree. I'm more of a traditionalist with the whole style of game, but like I just think he has revolutionized the game, and particularly the point guard position, because he's definitely a shoot first point guard, but he can distribute as well. So now,
but if he was on a team that you're putting together, he wouldn't shoot as much.
Correct. He would know his role, right?
I mean, he can make up. He can create.
He's a little bit of a liability on defense. I think John Stockton would be better than him defensively.
He will have a hard time with John Stockton.
He would, but I also think John Stockton would have a little bit hard time with.
Oh yeah.
Because it's a different era and style of basketball, and Steph can shoot over big guys, so he's easily going to be able to shoot over Stockton. But so now it goes to me, right, for number 2. So see how I did that?
I get it. Yep. Very nice.
Game over.
Yep.
Do I even need to say his name? His airness. No. So, yeah, MJ is going to be my shooting guard. No explanations needed. You got to find somebody that can lock him down.
See, the problem is, we need a defender. The problem is you've done this. You've been thinking about this. I got Kobe.
Yeah, that's a great one. If you would have picked,
Kobe. Yeah.
If it would have been some
cut.
different scenario, yeah, I think that's a great. Again, no explanations needed. It's like the best versus probably top 3.
Would you not pay to see the two of them go at it? I mean, like in their prime.
Have you ever watched those videos where they would show like Jordan doing a move and then Kobe doing the exact same move, and then they go? It was a fadeaway, then it was this move, then it was that move. It was about 2 minutes long. You can YouTube it. It is unfreaking believable. It was almost like the defenders were almost in the same position, and they both did the exact same thing. Now, obviously, Jordan played before.
Well, Kobe. Watched
and
that,
he admitted to
it,
that, right? He said, "I modeled my game after Jordan," and he did it like no other player, right? He emulated his game. So, but now you get your small forward or your 3 guard, however you want to look at it.
All right. I'm big on shooters. This is a shooting league, outside threes. Jordan was not an awesome 3-point shooter. Very
streaky,
average.
Right? There was that one game against the Portland Trail Blazers. He hit 6 threes, but that was very, very, very unusual for him. Most he would ever hit would be 2 or 3 in a game.
Yep. So, and Kobe in his own right wasn't that would not be considered a great 3-point shooter.
I would say he
Um,
definitely shot more than Jordan, made more than Jordan, but the league had started to change at that point where he needed to. But
yep.
they were probably similar in terms of like their ability to shoot a three. I kind of put them the same, but I think Kobe was
I
a little
got
better.
Kevin Durant.
Wow,
Kevin
that's gonna be a
Durant.
tough one because he's really, really tall.
Because I don't want him at power forward.
Yeah, no,
I don't know what his natural like. He doesn't really have a natural position. Really,
so
he can get 10, 12
I'm
rebounds,
gonna
but
go here, and this is very traditional. I'm going Larry. It'd be an interesting matchup.
yeah,
You could put Larry at the 3 or the 4, but I'm going to put him there just because I think I'm going to need something a little bigger, stronger.
he's like six
Yeah, he's
nine
big. He's
ish.
big, but
Larry
he's like
Bird.
white big, right? Like he's not going to jump out of the gym at
Yeah,
all.
yeah,
Quite frankly, barely going to get off the floor.
yeah. He dunked that thing
But a
once.
shooter,
No, he could dunk.
and just
Yeah, that would be an interesting
so
matchup there.
you know what I like about him is even though maybe he's definitely not near the athlete that Kevin Durant is, but I think that he would be able to match up against him because he played old style physical and is a
Yeah,
trash
physical.
talker, biggest trash talker ever in the
Yep,
league, I think.
yep,
All
yep.
right, so my 4, my power forward, I'm going to go with Karl Malone.
Oh, okay. Yeah, you want to split him up. You don't want him to play
No,
with
you
John
can't. It'd be
Stockton.
like me picking Scotty. I almost did that, but I needed more of a shooter. That's why I went with Larry.
I thought that's where I thought you were going.
Yeah.
All right, I've got um, Tim Duncan.
Yeah. Solid choice.
I mean, I think he's the best power forward of
Yeah.
all time.
Very, very fundamental.
No offense, Kevin McHale or pick your
Yeah. Or
person.
Karl Malone, right? I mean, both of those guys were very, very fundamental,
Yeah,
but like I think his
and play different.
longevity. I mean, he was in the league for 20 years, at least very close to that if it wasn't. All right,
Yeah.
you get the last pick.
Center is. Let me look at the.
Let me look at the computer here, see who it spits out with the analytics on this, right? Is that what you're doing right now?
Boop, 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 boop. Just fantasy football draft. Just auto draft. I just auto drafted this. Auto draft did not come up with John Stockton.
No, his
can
name
promise.
wasn't even on the
I can
available
promise you
list of
that.
players to draft.
Uh, I want someone to fit in.
Yeah, that's it too, right? You got to know your role,
Hard.
have some chemistry there.
Yeah. Yep. I mean, Kobe and Kevin Durant, KD are going to dominate the ball. So, Wemby. No, I'm just kidding.
In a couple of years, you may not be
Not yet.
you may not be joking about
Maybe
that.
5 years, I might not
Yeah.
be kidding. Put him and Kevin Durant, the all skinny
Yeah.
team. Give me Hakeem Olajuwon.
Oh, that was going to be. I was thinking of going there, and this may be a bad.
Well, I just like shooters. Like that dude
Oh.
with him and Tim
Couldn't
Duncan.
defend him.
How would you defend
Yeah, you couldn't
them?
defend him, especially when he would do the dream
And-
shake.
Yeah, they don't need to be shooting threes.
Jay, if you could put the
You
dream
know,
shake
I'm
in
a
there,
traditionalist.
right?
Yep. I don't want my center shooting threes. So I like that.
Okay. Well, I think it's going to be. It's going to change now that you picked him because he was pretty athletic too. He could get around somebody pretty quickly.
You were going to pick Bill Cartwright. But you're
Yeah,
gonna
no, I'm
go
gonna
somewhere
branch out a little bit. I usually go with one of 3 when I've done this before. It's either Shaq, Kareem, or Wilt. I've thought about doing. I think maybe I did do Hakeem last time actually, but I'm gonna do Shaq for this one. Big physical. You know he's not going to come
Okay.
out on the perimeter, so you got those other guys that can shoot as many threes as they want. So
I just the conversation. I mean, it's really sports talk radio conversation of comparing eras to eras. Like how I mean, Wilt would not dominate now. He's not even 7 foot
Yeah.
tall. Like he wouldn't, like it's
He
hard
was a
to,
man amongst boys.
it's hard to compare. Bill Russell, I mean, like I'll take Bill Russell's skill set when he was in his prime and what he was doing to them, but he's not going to, you look at Karl Malone and Shaq and that physicality on your back line, you know, none of those old school centers would have much to do.
No, they get tossed around like
that.
ragdolls. I do think, and I
Yeah.
mean, I'm obviously biased because he's my favorite player, but I do think you put Jordan in his prime currently because everybody's like, oh, the athletes are better. Yeah, they definitely are better, but he would still be, in my opinion,
But there's no one more athletic
putting
than him.
30 points up. I think you could make an argument with LeBron, but I think LeBron's even just more physical because he's physically taller, he's bigger, stronger. But like Jordan's speed, his defensive ability, and the biggest thing with him though was his competitiveness. There was nobody. I think.
It's the mental.
Kobe's the only person that I think is even in the same conversation with his will to win and not lose. So, well, that'd be fun if we could.
Yeah, I covered high school. I've been in Lower Marion where Kobe, obviously went to high school. I covered that was in the Philadelphia area. Have you all play? What was the Lower Marion
story?
Story. Did you guys play them? Or they bigger?
A couple. My best friend in college, med school, Jeff Montgomery. He's a primary care physician in Scranton now. Went to LECOM, but he played against Kobe in the Eastern Conference Finals, the game to go to Hershey. And then Keith Neese played at Mercyhurst, went to Cathedral Prep. They played Kobe at Hershey for the state championship.
Okay.
And Keith, I definitely need to reach out to him.
But didn't your parents go to Hershey all the time?
We did. That was our family trip. We would go to Hershey every single year. And that was we didn't go to Florida or this or that. It was kind of like you guys. We would do long weekends, and that was one of our trips. Was every year we go to Hershey. So well, Greg, This was a lot of fun. All I can say is this is a lot of fun catching up. Definitely want to pin you down for a red carpet episode because I think you have so much to offer from your years of primary care, sports med experience, but more like the business side of things, right? Like that independent private practice and the MDVIP spin too. I think it's so unique and so valuable, but I think that's what people are looking more and more for as we move forward too.
Yep. Well, physicians have come along. I mean, we've spent a lot of money, a lot of time. It's so frustrating to me to see friends of mine, colleagues, be miserable and be unhappy, and then you feel like they're punching a clock to go home and get out of there, and it's too bad. Like
highest suicide rate in the country is physicians now.
Oh my gosh, it's ridiculous. So there's other ways of trying to enjoy your work and your calling.
Yeah.
So I'm very happy to get with that.
Awesome. Well, in closing, I always ask one final question of all my guests is, where do you see Greg Beato in 5 and 10 years? And I know a lot of my guests are kind of similar age to us, so kids almost dictate that question a bit. But where do you see yourself in 5 and 10 years?
I see myself at Blacksburg, Virginia. I see myself retiring from Medical Associates, down the road. I don't see myself. I would be shocked if I'm not still working at Medical Associates in 5 and 10 years.
If you're not, or if you are?
If I am, I will be shocked if I'm not still working at Medical Associates. 10 years from now, I'll be 54. I imagine it'll be pretty much the same. I don't know that I'll do Virginia Tech forever. 10 years from now, well, let's say 5 years from now, Marco will be 16, Dominic 14, probably still doing the same, Virginia Tech, MDVIP. I think that Virginia Tech would be the one variable in my job that I might give up. Just because of the time
As your
and
boys are getting older too.
nights and
Yeah.
weekends. Yeah, and I think that if I had two children that weren't so involved in athletics and loving athletics, it would be hard for me to do the Virginia Tech piece and take so much time away from my
Right.
family. So I could see probably 10 years not doing that. They'll be out of the house. So somewhere between 5 and 10 years left of doing Virginia Tech. I really enjoy it, and there's a lot of perks to it and benefits. But so yeah, I mean, I it almost feels, I don't want to say boring, but kind of cliche to just be to say that I feel like I'll still be in the same place. But I think that just goes to show that I'm very happy with our life and our location and our house and our choices that we've made.
No, that's great. That's a great position to be in. I'm pretty much the same, right? I mean, a lot of it
Yeah.
is dictated by your kids, but also your happiness. And I couldn't see myself doing anything else. Definitely would not be employed at any point. I would be a horrible, horrible employee, probably the worst ever. But
Again, you mean it didn't work out before. It's not going to. Yeah, there is a zero chance that I would sell my practice to a corporation. I mean, that's not even in my thought process. I mean,
well, Greg, thank you again. Always great talking to you, connecting with you. We definitely need to plan a trip down to Blacksburg, and if you guys are up in the area later for any baseball games or anything like that, obviously reach out to us.
Yeah, man. Absolutely. Yeah, it's not hard to pick up where we left off, Ryan. It's always great catching up and I like to get up to Cockwell this summer.
Let's make it happen.
Take some money. Take
For
your money.
sure. Let's make it happen. All right. Well, thank you, Greg.
All right, my man. Thanks so much.
Okay,
Yep.
take care.
Thanks for having me.
Well, I have loved some fishing in the outdoors where I'm free. It's where I spent my time before I hurt my hip and my knee. When that doctor asked me, son, how'd you get in this condition? I says, they saw bones, I'm just carrying on an old family tradition. I wanna know, Doc, why do you think I got some pain in my joints from years of playing hard in this life that's too short? When that doctor asked me, son, how'd you get in this condition? I says, they saw bones and just carrying on an old family tradition. Yeah, yeah, yeah. Tell me all about it, Doc.